Well, again, good afternoon, everyone. My name is Casey. I work for the EMS for Children Innovation and Improvement Center, and I would like to welcome you to today's Pediatric Readiness Quality Improvement Collaborative session. And thank you for joining us. This is our 15th session. Before we get started with today's session, we would like to acknowledge that the EMS for Children Innovation and Improvement Center is supported by the Health Resources and Services Administration, which is within the U.S. Department of Health and Human Services. The contents are those of the authors and do not necessarily represent the official views nor an endorsement by HRSA, HHS, or the U.S. government. And as a reminder, portions of today's session are being recorded and will be posted to the EIC's website along with today's presentation. For nurses seeking continuing education credit, please add your first and last name into the chat feature, and we will share the evaluation link with you at the end of today's session. Our formal objectives for today's session are here on the slide for you. And then our agenda for today, we will begin by hearing from our participating sites, sharing an update on their QI work. Next, we will be discussing how to communicate your QI projects with your leadership, and closing today's session with an update on some PRQI data, trends, and general updates. When we wrap up the session, we will share that evaluation link for those nurses seeking continuing education credit. And as a reminder, there are 25 points of MOC Part 4 credit available. We will be sending a notification to those who are eligible to receive MOC Part 4 credit. If you do not receive an email from us and you believe you are eligible to receive MOC Part 4 credit based on your participation, please reach out to me at the Collaborative's email address, and I will help straighten that out. And as always, please feel free to use the chat function or come off mute, raise your hand throughout the meeting for any comments or questions. Moving along to our site updates. As a reminder, these are an opportunity for sites to learn from one another's experiences and implement similar approaches in their EDs. This is also a time for sites to ask questions of one another and of our SMEs on the call. So we hope to hear from you all as we progress through the collaborative. And if you have any questions about this, please feel free to reach out to us. So we are going to go ahead and get started with today's updates. And so as you have shared, we appreciate that, and we acknowledge the time and effort that you put into your presentations, and we look forward to hearing from all of our participating sites regarding their quality improvement efforts over the course of the collaborative. So if your site has not yet shared an update, we invite you to share during the November session. So please reach out to us at collaboratives@emscimprovement.center for additional information regarding that opportunity next month. So next up, we will be hearing from Dr. Saidinejad for some helpful tips on how to communicate with your hospital's leadership. And with that, I will hand it over.
Yeah, thanks so much. Hi, everybody. Great presentations. I always learn so much listening to all you guys and some of the challenges and how you overcome them. It's truly remarkable, all the work that everybody has done and what you've accomplished so far. So I'm going to just talk a little bit about specific approaches to communicating with leadership. I made these slides in a way that you can pretty much use them afterwards in any way you like. They're self-explanatory, but I just review them here with you. Can we go next? I actually have no conflicts, and I'm part of the EIC. So I think one of the first things that anybody who is trying to make a change has to be aware of is that when you go to the leadership for an ask, remember that a lot of other people are also coming to the leadership with ask. And the leadership has some responsibilities of things they are tasked to do that you need to make sure that what you're trying to do is in line. So one of the things is that they're responsible for the global picture. They're responsible for long-term goals. They're also responsible for making a really good operational decision on everything that they're working on, including budgetary considerations, the resources, the number of people that are going to be working on a project. Every institution is also tasked to be creative, to be innovative, and come up with new, better, brighter things to do. At the same time, you want to do safe activities. You want to be in compliance. You want to do things that affects the entire community that you're serving. And you also definitely have in every organization an emphasis on being prepared for times of extraordinary situations such as crisis. Next. So in order to do that, there's a few things one has to understand. Number one is that every institution is laid out differently. So it's very important for you to get a hold of the organizational chart for your organization and see who's actually doing what, who's responsible, what are people's titles. And in the institution that you serve, if you are trying to make a change, which of these leaders are the ones that are going to make it happen? You do have to do some homework on this, because titles are sometimes deceiving. So you have to also figure out who's actually the doer. You have to ask around. You have to do your research on this. Also, in some institutions like mine at Harvard UCLA, it's a pretty top-down approach. So you may not directly get the ear of your CEO. You may have to go through steps. You have to go to whoever reports to whoever, and then step by step get you up there, right? Not only that, but is it the CEO who is actually in charge of this, or is there other operational leaders that make the work happen? And then you also have to think, who else should you be working with? Because a lot of the projects that you're coming up with, maybe other people in other divisions have similar ideas. So if you think what you're doing interfaces with them, it's not a bad idea to get some people on board from the other entities within your organization. Next. So the first step in trying to get your ask heard is that you have to make sure that your own team actually feels that this is a good idea and they're going to support that. If your own division, your own department is not on board with it, it's going to be very hard to convince anybody else. So first, generate buy-in from within. Then you have to think about where are the organizational priorities, or as many call it, a true north or North Star or whatever they call it, because it really needs to align for the better of everybody, for the good of everybody, and not just what you need. And you have to also think of, what am I asking for? Am I asking for a lot, or am I asking for a little bit? And am I asking the organization to spend money on this idea? And if so, how much? So these are all important considerations in trying to determine if you're going to be successful. Next. So feasibility is at the root of all of this. So you have to think yourself, if I were the one who I'm asking question from, can I find a way to make this work? Is it easy? Is it something that I personally have a solution for? And have you also heard about other projects that are in the pipeline, things that you may be competing with, and have you considered the project priorities for everybody else's? And then the other thing is timing, right? If you're having a budgetary crisis and layoffs and things like that, that it may not be a good time for you to be asking for something that requires funding. On the other hand, if you're asking for something that saves money, that's probably the best time to do it. So it's very important to have a sense of what is a good timing. And again, I would say that you do need to do your homework a little bit, try to figure out what the organizational directions are and where organization lies in. And this is not difficult. You know, a lot of organizations have CEO reports or newsletters and things like that, that they talk about the major things that are going on within their organization. And then not only that, but you have to understand how much time commitment, how many people need to be involved. And once you, let's say, succeed in this, who is going to make this continue? You need to have people that are committed for the long term. So those are some of the feasibility issues that you have to think as you're sitting down to think about your ask to the organization. Next. So let's say you have succeeded and you have a seat at the table. You made that appointment. You're actually sitting with leadership. You have their ear. So these are some very important considerations that you probably are aware of, but it's important to still kind of highlight them. Make your ask very specific, very concise, and show them all the data that goes with it about why this works, why this is important. And also know about the person you're talking to. What is their style? How do they like to be talked to? Are they short attention span? Are they ones that need elaboration? So when you go in there, it sounds like the conversation is comfortable. And you honestly will get your first chance is your best chance. So make sure that you come off right away very clear with lots of data and sure of what you want to do and the fact that you have considered the impact that it makes. And don't stay around too long. Make your case. 15, 20 minutes, probably a good pitch at the most. And then just let the person you're talking to talk back the rest of the time and ask questions. And the more questions they ask, the more successful you've been. Always take a positive tone. Be energetic. Don't use the word but. If you can, just use and instead. Those are some of the kind of simple things, but it really go a long way. And also present it in a way that you are concerned and considering the same things that they're concerned with and they're considering. So show that you're part of the same team and you're not going in there complaining about something that is affecting you but doesn't affect the organization. And finally, don't expect a yes right away. You expect somebody to be interested, to ask some questions, and you leave room for negotiation and additional discussion because you do need to come back. Next. So success may not be, like I said, the yes. Success may be that you got an acknowledgement of the problem that you brought in is important, for example. But always remember, you got your appointment, you got to go in there, you got a seat at the table, you're able to present your idea. Now the leadership has heard about it. And believe it or not, even if you don't follow up, the institution knows that this team had this idea. And if the subject comes up again, they're going to come right to you and say, remember that thing you talked to me about? I want to talk about it now. So sometimes it is longitudinal and it's not right at the moment. Celebrate any little win you can. Be very persistent in what you want, but don't be confrontational. Be very cordial with them. And always talk about the team, not about yourself. If you say, I'm going to do something in the next few days, make sure you do that and come back and report, hey, you know that thing I told you I was going to do, here it is, and here's my data. And always report back and check in to follow up on the conversations you've started. Next. So this is just to kind of give you, I'm not going to go through these cases, but I want you to think about this. Something simple. Your ED nurses really need a break room, and you want to try to get a break room for them. What are considerations that you have to make, right? You have to consider, am I asking for a new room to be built? Am I asking for that storage closet who's never being used to be repurposed so we can have, nursing a break room? Are we actually asking to take one of the rooms that are currently being used for patient care and converting it into a break room? So you have to understand that depending on what the use of that space is, you may or may not have an easy time getting that done. So it is a matter of how you're going to present the need of the nurses to have a break room. You can't say the nurses need a break room. You have to talk about how it improves patient care, how it makes nurses be able to be more relaxed, make better decisions, things like that. But it's just a matter of whether or not it's easy available room or not. That's just one example. Another example next is you're trying to be involved in PRQC like many of you guys are. And the challenge really is that nurses often don't get protected time to be involved in this work. It is expected that they do this in addition to everything else they do. So if you are trying to bring the consideration, hey, I'm doing this great work, it's amazing, but I need 4 hours a week, let's say, protected time, so I'm going to work on this project, you have to consider what does that mean for the leadership. If the nurses have never, for example, gotten protected time, it will be harder, but maybe nobody has ever broached the subject. So you can go through all the steps we talked about before and present why being part of this PRQC is actually helps improve patient care outcomes, because you have to think of what end goals are, what longitudinal goals are, what institutional priorities are. So this is an easier discussion to some extent than the break room. But in other ways, it may be a lot harder to do because now you technically are asking for money, right? You're asking for 4 hours of paid time, which would have been given to clinical work, now to be given to this. So somebody else will have to spend 4 hours of clinical work to substitute for the time you're not there. So these are kind of considerations to make. And then my final slide is just to conclude what I was just telling you, is that this is like a checklist. Always think about this. You have to have empathy for the position of where the management stands and what they have on their plate. You have to ask yourself, is what I'm asking really feasible? You have to make sure that your own team is feeling good about it, that they support that. You have to also think about how this is going to serve the institution and the community. And you have to think of it in a way that we're all working together and this is a win-win. You have to show it, present it that way of what's in it for them, just like what's in it for you. And don't define success with the immediate yes. Understand that success can be incremental, and that is just why you have to keep at it. Just like you guys were discussing in earlier, that you have months where your numbers are great, months that are, your numbers are not great, but you have to keep at it because the net goal is towards a direction of up. So month by month doesn't matter, but overall your trajectory is up. And always think about 5 years from now, 10 years from now, and be very persistent. You are a pioneer at what you're doing. A lot of this work has not been done before, but a lot of it ends up improving the care of patients and improving the way the hospital and your healthcare system looks on the outside. So it's very important to be able to show those. And I think that's all I had.
Thank you so much for sharing. A lot of great tips and some things to think about as you start looking ahead to what's next for your quality improvement work. So thank you again for joining us today and sharing your tips and tricks with us. All right, and with that, I am going to go ahead and hand it over to Lisa to share an update on MPRQI with everyone.
Thank you, Casey. Let me go to the next slide. So just a brief announcement about office hours. The next session that's coming up is going to be on October the 22nd. I believe we have 2 slots that are still open. So these are great opportunities for sites that are participating in PRQC and entering data into MPRQI to address questions around data entry or possibly understanding and interpreting your dashboard. If you're at a point where you really want to do a deeper dive into your data, we can experiment with the filters that are on there so you can kind of slice and dice your data. If you're looking to get support around quality improvement strategies or preparing again for future presentations as we kind of close out the collaborative, these are all great reasons to join office hours. And as Mel was talking about, maybe even continuing that conversation with leadership if you'd like some support in terms of getting resources that you can share with leadership as it pertains to continuing participation in quality improvement activities for pediatric emergency care. We can help you with that in office hours as well. Next slide. So again, just kind of thinking about MPRQI data collection target. So even though the collaborative is ending in December, the great news is that the MPRQI data tool is still going to be available for all PRQC participants for as long as you need it. And ideally, what you want to do in terms of ongoing data entry is to continue to enter charts at regular intervals. Really, again, based on your team's bandwidth and patient volume and just ability to be able to do that data entry. Some folks may decide that they're not necessarily going to continue at the same level that they did for PRQC, and that's okay. Even just 5 charts a month is going to help you get a view of your performance over time. Next slide. So as I had mentioned, EDs will continue to have the ability to access the data portal as well as continue to access office hours. So you'll still continue to get those emails about notifications for office hours in case you would like to sign up for that. And then I am getting a few emails in terms of wanting to update users. So in case you need to add or remove users, you can actually send an email to our administrative assistant, Beverly Swanson, and just be sure to include the user's first name, their last name, their email, and their access level, and we can get those changes taken care of you. The next slide. So exciting updates in terms of data entry. We now have 103 sites that are entering data into the data portal, and we have over 14,000 records. So that is just exciting news, and the number just exponentially continues to grow. And next slide. And just a little brief update in terms of some of the performance that's happening related to PRQC. Currently, those sites that are entering in data are predominantly PRQC sites. So really kind of looking at all of the key indicators in terms of core measures that we've seen some improvement for pediatric patients with weight documented in kilograms. We know lots of folks are focusing on that, as well as percent of pediatric patients with pain assessed. That's been a big area of focus as well. And in case folks, oh yeah, no, you're fine, go ahead. We were going to show one on suicidality as well. So just, we know that some folks are focusing on that. So just really kind of seeing the trend for pediatric adolescents who are assessed with a suicide screening tool, as well as percent of pediatric patients with a positive suicide screen. And then those positive suicide screens that received a consultation. So it's really good to see those numbers. I know a lot of folks don't necessarily look at the graph view. I think it's always just human nature to initially just look at the data per se, which is the table view, which many of you all are familiar with. But when the graph view, one of the great benefits of this is you're actually able to see your performance over time. You can break it down by quarter. And for those sites that have a lot of data entry, you can actually break it down by month, by week, and even by day. And as we are entering into the third quarter for data entry, we're asking sites to continue that data entry. We are really wanting to be able to establish an increase in performance for sites. And so ideally, sites that can get their records in and be able to meet a specific threshold. I think initially we're looking at sites that have at least 60 charts, and then we'll possibly even look at a higher threshold than that. But that would be the minimum that we would be able to report out any performance improvement on your particular site. So I'm going to go to the next slide. That one's yours, Casey.
Thank you, Lisa.
Mm-hmm.
I did want to check in and see if there were any questions before we move into our updates.
Casey, I had put a question up in the chat about the meetings. Are they continuing after December?
So I think we're beginning to discuss, and based on interest, we asked at the end of last month's session if there was an interest in continuing after the end of the collaborative in December with a community of practice. We sort of gauged how frequently the group would be interested in meeting. Based on the number of responses we received then, was a 50-50 response to wishing to continue with something like a community of practice. And it looked like the interest would be in quarterly meetings. I don't know, with our group online, is that something that you all would be interested in? And we'll continue to bring that back to our PRQC team and discuss that further and share with you whenever we have updates as well. But that's sort of based on last month, the feedback we received was a quarterly opportunity to meet as a community of practice. What everyone's thoughts on that would be.
I like that. You know, it's not too much.
All right. well, I'm sure more to come on all of that as we wind things down in terms of the monthly participation within the PRQC. So we do look forward to our next two meetings, November 19th and December 17th. I see Eleni has put the link there to register for those. And then we do have a few additional reminders we wanted to share with you today. We have been conducting qualitative interviews with PRQC participants related to your time with us in the collaborative, as well as your utilization of MPRQI. We've been able to meet with 8 sites so far. We would love to hear from more of you. So if that's something you're interested in doing, we've been reaching out to your team lead at your site. We currently have time set aside for the 22nd and the 23rd of October, but we're willing to work with you and select a time that works best for you and your schedule as well. So if that's something you're interested in doing, please reach out to us and we'd be happy to schedule that with you. And then your team leads have also received an invitation to complete a survey. So if you're the team lead and you've seen that, we appreciate your response. If you're on, but your team lead is not, we would love for you to maybe reach out to them and see if they've seen that email from us and would be willing to complete that survey as well. So I think those are all the updates I have. Are there any other questions related to anything we've discussed today? All right, well, we do appreciate your time. And again, if you're looking to earn nursing continuing education credit, please make sure your first and last name is the chat. And then you can share with us your feedback with that link that Eleni put in the chat as well. And we'll get that information too. All right, well, thank you all for joining us today. And we look forward to seeing you in November or in a couple days for MPRQI office hours. With that, if you have any other questions, we'll be on for another minute or two, but we hope you have a great rest of your day.